Mrs. Princey, Associate Professor in Mental Health Nursing. Our mood changes based on the various situation. But a normal individual is able to manage his mood and control his emotion. So there are individuals who are not able to control their emotions or the mood. So such kind of clients, we can say that they are suffering from a psychiatric disorder. It can be the two ends, okay, of a mood disorder, of mania or the depression. So one of the important drug that we are using for treating these mood disorders are the mood stabilizing agents or the mood stabilizing drugs. Yes, the topic for today is the mood stabilizing drugs. These drugs are very effective in the treatment of manic disorders. So these drugs are termed as the anti-manic drugs. But these drugs can also be used as a prophylactic agent for treating the bipolar disorders. So the better term which can be used for the antimanic drugs are the mood stabilizing drugs. One of the very important drug that we are be using for treating the manic conditions, we can say the drug of choice for the manic disorder is the drug lithium. Let us see the history of the drug lithium. Lithium is an chemical element with the atomic number 3 and the atomic weight 7. The element was used in the year 1817 by Alfredson for treating the conditions which are related to the cardiac system. It was used for treating gout and for salt replacement in cardiac disorders. But it caused the toxic effect, right? It used to be very fatal. That's why this drug use was restricted in the cardiac patients and in the gout. This drug, lithium, was rediscovered by John Cade in the year 1949 for the treatment of manic condition. Since then, the drug lithium has become the drug of choice for treating the manic disorders. The functional class of lithium is the anti-manic drug. The chemical class is alkaline metal ion. The trade names of the drug lithium: carbolith, siballith, escalith, lithane, lithonate, and licarb. So these are the trade names of the drug lithium. Moving on to the indications of the drug lithium. So as I told you, the major indication of the drug is for the treatment of acute manic conditions. Apart from that, we have got the other indications like prevention of bipolar disorder, schizoaffective disorder, where the client will be having both the conditions of schizophrenia and the mood disorders of manic type. The next indication is it is used as a prophylaxis in the unipolar mood disorders. It is used in the conditions of cyclothymia, chronic alcoholism, and also it is used in impulsive aggression. These are the indications of the drug lithium. Moving on to the contraindications. So we have to be very careful and note that the client is not having any of these disorders before we administer the lithium. So what are those contraindications? Hepatic and renal diseases, brain trauma, organic brain syndrome or the organic brain disorders, pregnancy and lactation, severe cardiac diseases, and severe dehydration. So these are the conditions that we will not be administering the drug lithium. So as a nurse, you should carefully monitor and do the assessment to find out whether the client is having any of these disorders. Moving on to the special precautions. So if the client is elderly, is having the thyroid disorders, seizure disorders, diabetes mellitus, systemic infections, urinary retention, and children below 20 years of age, see to it that it is used with the precautions, right? So as much as possible, you need to avoid use of these drugs. But If the drug is highly indicated, then you have to use with a special precautions and monitor the client frequently. So that was about the contraindications of the drug lithium. Moving on to the pharmacokinetics when the drug is taken, so how it is going to act in the body. It is rapidly absorbed by the GI tract. The drug reaches the peak serum level between 30 minutes to 2 hours. So you can imagine the peak level, how fastly the drug will be able to reach. So within 30 minutes to 2 hours, the peak level of the drug will be reached. The steady state level of the drug in the serum to be maintained, it takes about 7 days. The proximal reabsorption of the drug is mainly influenced by the sodium depletion and sodium balance. So very important thing, if the sodium is depleted, the sodium level is decreased. So what happens? The blood lithium levels will be increased, leading to the lithium toxicity. So always there should be a balance between the sodium intake as well as the lithium level, since it is going to have a very toxic effect if there is a loss of fluid or loss of sodium from the body. Moving on to the mechanism of action, the exact mechanism is unknown, but it is believed to accelerate the presynaptic reuptake and destruction of the catecholamines. It inhibits the release of catecholamines at the synapse. So, if you take the condition of mania, you have seen that there is an increase in the neurotransmitters, that is especially the norepinephrine as well as the dopamine. So, when this drug is being administered, it will inhibit the release of the catecholamines into the synapse, thereby controlling the neurotransmitter level. It decreases the postsynaptic serotonin receptor sensitivity, thereby, the serotonin level also will be managed. The overall mechanism of action is to bring down the catecholamine levels, thereby ameliorating the condition of mania. So that is the mechanism of action of the lithium drug. Moving on to the available form of the drug lithium. Lithium is mainly available in two forms. One is lithium carbonate, the second drug is lithium citrate. So lithium carbonate drug is available in 300 mg tablet form as well as 400 mg sustained release tablets. If you take the lithium citrate, it is available in the injection form as well as the tablet form. We have got 300 mg of tablet or 5 mg in the liquid form. So that is about the available form of the drug lithium. Moving on to the dosage of the drug. So usually the overall dosage of the lithium drug, if you take, it's been given as 900 to 2100 mg per day in divided doses. So usually TID it is given. The maintenance dose is given as 300 mg TID or QID daily basis. So that is about the dosage of the drug lithium. So moving on to the blood lithium level. So very important when the patient is on the drug lithium to monitor the blood lithium levels, because the lithium toxicity can be noted very soon. Right? So let us see the blood lithium level, how it varies. As a therapeutic level, the blood lithium level is 0.8 to 1.2 milliequivalents per liter. When it is given as a prophylactic use, the prophylactic blood lithium level is between 0.6 to 1.2 milliequivalents per liter. And the toxic level. So when can we note that the client is having the lithium toxicity in the blood? So if the blood lithium level is more than 2 milliequivalents per liter, then we can say that the client is having the lithium toxicity. So that is about the blood lithium levels of. So that is about the blood lithium levels. Moving on to the drug interaction. So when the drug is administered, if the client is taking any other medications along with the lithium, very importantly that you have to monitor for these and try to avoid these intake of drugs, because it is going to have an effect on the absorption of the lithium. When the client is given haloperidol, there may be chances along with the lithium. When the haloperidol is administered, the client can end up with the encephalopathic syndrome. So very carefully you have to note if the patient is having this drug haloperidol. If the patient is on any of the diuretics or no non-steroidal anti-inflammatory drugs, so we call it as NSAIDs drugs. So if the client is on these drugs, it is going to cause the toxicity. So note for the client if that is using these diuretics or NSAIDs. And also note that if the patient is on potassium iodide, solutions or the medications, it may have an interaction causing the hypothyroidism, causing the hypothyroid effect. So very importantly, you monitor these conditions. If the client is on these drugs for treating any kind of a medical disorders like aminophylline, phenothiazine, sodium carbonate drugs, sodium chloride drugs, these drugs are going to hasten the excretion of lithium, leading to decreased effect of the lithium, right? It is going to quicken the excretion, resulting in decreased effect of the lithium. So see to it that the client is not on these drugs. Another drug which can have an influence is the phenothiazine. So when the client is on lithium, it may reduce the effect of the phenothiazine group of drugs. So that is about the drug interactions. Moving on to the adverse effects and the nursing management. So very carefully when the client is on the lithium to monitor the adverse effect and give the interventions accordingly. The major thing that you will be noting as a side effect is the lithium toxicity. If you note the therapeutic level of lithium in the blood, it is found to be zero point 0.8 to 1.2 milliequivalents per liter, and the toxic level will be more than 2 milliequivalents per liter. So you can note that there is a very narrow so you can note that there is very narrow margin between the therapeutic level and the toxic level. Very soon the client will reach the toxic level because of the margin which is very narrow. So always note that the lithium toxicity doesn't happen in the client. So how do you know that to monitor? So how do you do such a management? First thing that you have to do is to monitor the blood lithium levels, when the patient is on the drug lithium. You have to monitor the serum lithium levels in the client once or twice a week for that matter, to monitor if the patient goes for the lithium toxicity when we initially start off with the treatment until the maintenance dose is being achieved, or we give the stable dose for the client. Once the stable level of the lithium is reached in the blood, so we'll be doing the test for the lithium in the blood at least for once in a month when the client is on the maintenance dose. So when should you draw the sample? Usually the sample should be drawn 12 hours after the administration of the drug lithium. So that is an important thing to be done. And you can note that the symptoms of lithium toxicity usually can be noted if the serum level of lithium crosses more than 1.5 milliequivalents per liter. Even though the toxic level is of the lithium in the blood is more than 2 milliequivalents per liter, if the client reaches that level of 1.5 milliequivalents per liter itself, you can start noting the symptoms of lithium toxicity. Now, what are the symptoms of lithium toxicity based on the level of the serum lithium levels, right? If the serum lithium level is between 1.5 to 2 milliequivalents per liter, so these are the symptoms that you can note for: blurred vision, tinnitus, ataxia, persistent nausea and vomiting, and severe diarrhea. So these are the mild symptoms that we can say when the lithium level in the blood, is toxic and is between 1.5 to milliequivalents per liter. If the serum level of lithium reaches 2 milliequivalents per liter to 3.5 equivalents per liter, then you will be noting for these symptoms: excessive output of the dilute urine, increased tremors, irritability, psychomotor retardation, mental confusion, and giddiness. So these are the symptoms which is a little more severe than the first symptoms that you have seen. If the serum level of lithium crosses more than 3.5 milliequivalents per liter in the blood, then you can see there are severe life-threatening symptoms that is noted, which can be fatal in the client. We have got the impaired consciousness, nystagmus, seizure, coma, oliguria, anuria, arrhythmias, myocardial infarctions, and cardiovascular collapse. So these are the life-threatening, symptoms that will be noted if the serum level of the lithium is toxic and it crosses 3.5 milliequivalents per liter. So always you have to be very cautious and make sure that you do the investigation of blood lithium level, frequently, so that the lithium toxicity can be identified in the earlier stages and can be treated. Before even starting the lithium therapy, you have to monitor the serum lithium levels, so that will be, so that will be helpful in the administration of the dosage. And if the toxic level of lithium is reached, that is nearly to 1.5 milliequivalents per liter, immediately you have to stop the drug lithium and inform the physician or the psychiatrist that this is what the lithium level is, and we have stopped the drug. Moving on to the side effects of the lithium. So, number one, you've got the neurological side effects: tremors, muscle weakness, cogwheel rigidity, seizure, and neurotoxicity. So, these are the side effects related to the neurological system. Moving on to the side effects which is seen in the renal system, we can note the polyuria tubular changes, nephrogenic diabetes insipidus, and nephrotic syndrome. If you take the cardiac system, again we have got the side effects of changes in the cardiac system. The symptoms of hypokalemia can be noted, the ECG changes and depletion of the T wave in the ECG. If you take the endocrine system, we've got the side effects of goiter, hypothyroidism, unusual weight gain, which can be noted, and abnormal thyroid functions. The next side effects is in the GI system. We can note the patient having nausea, vomiting, the diarrhea, metallic taste in the mouth, as well as the abdominal pain. So if you take the dermatology or onto the skin, the side effects which can be noted are the psoriasis and papular eruptions. So these are the changes which happens onto the skin. If the lithium is administered in the client who is pregnant, it can cause the major teratogenic effects in the child, Epstein's anomaly that you can note, and also toxicity in the infants if it is administered. Okay, so that is a major side effect that you have to monitor. So that is about the side effects of the lithium. So another important thing that, as I told you, there is a close interaction with the sodium as well as the lithium. So the sodium is going to have an influence on the lithium. Since both the chemical structure are similar, there will be there will be an influence with each other. Say, for example, there is a decreased sodium level in the blood, or if the client is having the conditions wherein there will be chances for the sodium depletions like excessive perspiration, nausea, vomiting, diarrhea, fever. So all these conditions will lead to depletion of sodium in the blood. So when there is a depletion of sodium in the blood, the lithium reabsorption will be increased in the kidneys, leading to the lithium toxicity. So excess of sodium loss leads to the increase in the lithium level in the blood, leading to the lithium toxicity. So to avoid this condition of lithium toxicity, you have to carefully monitor the sodium level and also see to it that you educate the client to take the sodium rich diet and fluid intake of about 2500 to 3000 ml per day, so that there is no depletion or sodium loss which can increase the risk of the lithium toxicity in the blood. See to it that you monitor the intake output chart and weigh the client on a regular basis, daily basis, so that you can note for these changes. Moving on to the client and family education when they are on this drug, lithium. Educate the client and the family to make sure the client takes the medication on a regular basis even when he is feeling well. So initially when they start taking the medications lithium, they can note that there is an improvement in the symptoms. Okay, just because there is an improvement in the symptoms and the client is feeling better, the family or the client himself may stop taking the medications, which is later on going to cause again the problem of mania or other psychiatric problems. So see to it that you educate the family that even though the client is feeling well, to complete the course of the drug and to meet the psychiatrist before stopping the drug. Educate the family and the client not to drive, okay, not to use any kind of a machinery when until the lithium level is stabilized in the blood, because there is a chance of dizziness and drowsiness which can cause accidental injury in the client. Since there is a close connection with the lithium and sodium, educate the family as well as the client that the diet should include the normal sodium content, and also it takes about 6 glasses of water, 2,500 3,000 ml of water per day, so that the chances of lithium toxicity can be prevented. Educate them to avoid excess use of beverages containing the caffeine, like coffee and tea, which is going to stimulate the urine output or urine excretion. So, when the urine is excreted or there is a loss of fluid or from the body, or sodium will be lost, resulting in increase of the lithium level in the blood, leading to toxicity. So, to prevent the lithium toxicity, educate them to avoid using excess beverages. If the client is experiencing any symptoms of nausea, vomiting, diarrhea, immediately they have to inform the particular psychiatrist or the physician, because excess loss of sodium can happen, can lead to the lithium toxicity, which is very very severe. Another important education that you'll be giving is to educate the client to carry a card or identification data, stating that he is on the drug lithium, so that any accidents or any untoward happens, okay, they can have an idea that he is a psychiatric patient, that he is on the drug, and whatever the treatment that the doctors can give, that they will take the necessary precautions. Another important education that you will be giving for the female clients is to be aware of chances of becoming pregnant when on the lithium therapy, and also educate them to use the contraceptive pills for the safety. If they have a plan for pregnancy or accidentally they have become suspected for pregnancy, to immediately inform the class physician, because the drug lithium is going to have a teratogenic effect on the fetus. The next education that you will be giving is on the side effects as well as the lithium toxicity. Very important that you have to inform the client and the relatives about the side effects that can happen or the toxicity that can happen in terms of the symptoms. Okay, if the client develops these side effects or symptoms of persistent vomiting, nausea, diarrhea, okay, ataxia, blurred vision, tinnitus, excessive urinary output, increased tremors or mental confusion, immediately they have to inform the physician. So that education that you will be giving to the family. Educate them to keep the appointments for the follow-up visits and to monitor for the serum lithium levels every 1 to 2 months, or based upon the instructions given by the physician. So that was about the drug lithium, which is a major treatment for the many conditions. So we have the other group of drugs which are also used in treating the mood of the client. So one such drug we have is the sodium valproate. Let us see the brief history about the drug sodium valproate. Valproic acid was first synthesized by Burton and used as an organic solvent. In the year 1963, when he discovered that this drug sodium valproate is having an anti-epileptic property which can be used to treat the seizure. In the year 1966, Lambert reported that this drug, the sodium valproate, can also be used for treating the medic conditions or the mood disorders. So that is about the brief history of the drug. So what is the functional class of the drug? It comes under the group of the anticonvulsant. The trade names we have Encrate, Valproate, Valprol, Epilex. Moving on to the indications of the sodium valproate is It's widely used in all forms of epilepsy and in febrile seizure in case of the children. It is used in the treatment of mania and also in treating bipolar disorder as a prophylaxis. It is used in the treatment of migraine and pain syndrome. It is used in children who are suffering from ADHD, attention deficit hyperactivity disorders. It is used in dementia, wherein the client may have the behavioral agitations. Also used in schizoaffective disorder, wherein the client is having both the conditions of schizophrenia and the mood disorders. The special precautions that you have to keep in mind when you give this drug in the women of childbearing age, people who have the hepatic disorders, and also who are having the renal impairment. Since this drug is going to prolong the bleeding time, you have to carefully give in these individuals. What is the dosage of the drug? So the usual dosage is 1000 to 3000 mg per day in 3 divided doses or undivided doses. That's the dosage of the sodium valproate. Number one, as a valproate sodium, divalproex, and also as a chrono preparations. Moving on to the pharmacokinetics of the sodium valproate, it is rapidly absorbed from the GI system after the oral administration of the drug. The peak level of the sodium valproate will be reached in the blood for about 1 to 4 hours after the administration of the drug. Moving on to the drug interaction, so very important when the client is on sodium valproate, if the client is taking any other medications, there will be an interaction with those drugs. So first one is the CNS depressants. So it is noted that there is a decrease in the effect of sodium valproate when the CNS depressants are administered along with this drug. If the valproic acid is administered in a client who is also receiving phenytoin and clonazepam, it can result in the seizure. So very carefully monitor if the client is using these drugs. If the client is taking any kind of the aspirins or warfarin and he is given the valproic acid, very important, you have to note it can prolong the bleeding time, right? So that is what the effect of the sodium valproate, which is going to increase the bleeding time. So carefully monitor if the client is taking these drugs, aspirin or warfarin, along with the sodium valproate, so that you can avoid these complications. Moving on to the adverse effects of sodium valproate, we have got nausea, sedation, tremors, flushing, weight gain, menstrual disturbances, hair loss, acute hemorrhagic pancreatitis, and Steven Johnson syndrome. So these are the adverse effects of sodium valproate. What are the nurse's responsibility when the client is on sodium valproate? Since the drug is going to prolong the bleeding time, as a nurse, you have to monitor the bleeding time, the clotting time, okay, before you administer the drug sodium valproate. Also monitor if the client is having spontaneous bleeding or any kind of bruising under the skin, which indicates the hemorrhages, right? So these things are very important when you administer the sodium valproate. So that is about the drug sodium valproate. We'll move on to the next antigenic drug, which is the carbamazepine. This carbamazepine is a tricyclic compound which is synthesized by Snyder in the year 1953. It has got a structure which is similar to the tricyclic antidepressants. If you take the onset of action, onset of action is faster than the drug lithium, but it is slower than the sodium valproate. Moving on to the functional class, it belongs to the anticonvulsant group. Okay, the trade names of these drugs: Tegretol, Mazapine, Monocarb, and Carzip. So these are the trade names of the carbamazepine. Moving on to the indications of the drug, it is used in grand mal seizure or epilepsy, general tonic-clonic seizure, partial seizure, alcohol withdrawal, trigeminal neuralgia. It is used in many conditions, bipolar affective disorders, especially where patients are intolerant to the lithium, they are not responding to the drug lithium. Carbamazepine is an alternative which is used. It is used in impulse control disorders and borderline personality disorders. What are the contraindications of the drug? So if the client is having a history of bone marrow depletion, so in those cases the drug is contraindicated. Moving on to the special precautions, you should not abruptly withdraw these drugs, okay, especially when the client is on carbamazepine, because he may have untoward reactions. If it is given in the women, okay, who are in the childbearing age, they, if they are using any kind of a contraceptives, it can lead to contraceptive failures leading to pregnancy. It should be used with caution in children below 6 years of age, and also in individuals who are having these conditions of cardiac, hepatic, and renal impairment. So, that is about the special precautions. Moving on to the dosage of the drug. So, the usual dosage that is given is 600 to 1600 mg per day in divided doses of carbamazepine. Moving on to the drug interactions. So, when this drug carbamazepine is administered, with the other drugs, it's going to increase the effects of the carbamazepine. So drugs such as erythromycin, verapamil, isoniazid, and propaxifene are going to increase the effects of the carbamazepine. So make sure the client is not taking these drugs when he is on the drug carbamazepine. Decreased effect of the carbamazepine can happen if the client is on these drugs like phenytoin, primodine, and phenobarbital. So these are the drugs which are going to decrease the effect of the carbamazepine. So when this drug is administered, note that these drugs are not being administered, which are going to decrease the effects of the carbamazepine. Very important, another drug interaction is concurrently, if the drug is used along with the lithium, it is going to cause the effect of neurotoxicity. So very important, you shouldn't concurrently use the drug lithium and the carbamazepine. Moving on to the adverse effects of these drugs, we have got diplopia, it's a double vision, drowsiness, dizziness, nausea, vomiting, ataxia, skin rashes, photosensitivity, cholestatic jaundice, leukopenia, bone marrow depletion, and agranulocytosis. So these are the adverse effects of the drug. Moving on to the nurse's responsibilities or the nurse's implication based on the drug carbamazepine. Ensure that the client monitors the blood levels frequently when the client is on this drug carbamazepine, since it is going to have the cardiac, hepatic, and renal impairments. Make sure the client goes for a bone marrow test, since it is going to cause a bone marrow depletion. Since there is adverse effect of drowsiness and dizziness, you instruct them not to drive or use a machinery, since it can lead to accidental injuries. So that is about the drug carbamazepine. Very important, when you take the mood stabilizing drugs, we have the first drug of choice, which is the lithium. We have got the other drugs which are also used in treatment of mania and the bipolar disorders like sodium valproate and the carbamazepine. So when the client is on these drugs carefully, you have to monitor for the contraindications and also monitor the serum levels of these drugs periodically, so that you can notify if there is a toxic level that is reached, and you can meet the needs of the client immediately. Right? So this is about the mood stabilizing agents. Hope you all have understood the topic. Thank you.